CDC has recently published in March 2023 a study findings of autism across 11 states. Study was conducted in age group of 4 up to 8. It was directing a study in finding the effects of COVID-19 in autism diagnosis, classification, and intervention. From these findings, it is concludes that autism prevalence varies among states. For instance, California has a higher autism prevalence. Other states also have the prevalence, but not as high as California. But this is based on this specific study. Boys show more autism compared to girls. And also, it shows that autism classification, diagnosis, classification, and intervention was much delayed or interrupted because of COVID-19. Prior to COVID-19, autism diagnosis, classification, and intervention was really working well throughout this 11 states. But after that, it was much slower or interrupted or stopped. All in all, to give this autism treatment and classification and diagnosis and intervention. So this is the effect of the pandemic. That's what it states in this study. This study also states that non-whites show more autism prevalence than white community, which states that more study has to be conducted to find out the reason why this is happening in non-whites compared to white community. In age 4, another point that we have to pay attention to, in age 4, there were more diagnosis, classification, and intervention of autism compared to in age 8, which shows that autism is given a good attention in early ages of these children. They are being screened at early ages. They're being classified. Their autism is being classified at early age, and they're being getting good care and therapy intervention at early age. This is a good sign. But also, it suggests that in age 8, this classification, diagnosis, and treatment has to be strengthened, has to be promoted, has to be increased, even though the kids are older than, age 4. So what the concern of this study is, the effect of this COVID-19 in autism will be a long-lasting, which we will see in the years to come. And also, another suggestion is that the country's health system has to have a second alternative effective system of caring for these autism kids when we have a pandemic such as COVID, international pandemic, or international communicable disease, or national pandemic disease. We have to have a backup system like telehealth to classify, diagnose, classify, and intervene in autism treatment.